Hi, my name is Carol Swetlik. I'm one of the Cleveland Clinic PGY4 Chief Neurology residents. Today I will present a simulation-focused education project titled PGY1 Neurology Bootcamp Leads to Increased Trainee Knowledge and Confidence in Neurologic Emergencies Management and Procedural Skills. The Postgraduate Year 2, or PGY2 year, marks a critical transition in neurology training, as the PGY2 resident becomes the first line of triage for evaluation of acute neurologic deterioration on the inpatient neurology services. Recognizing the increased autonomy required for this role, we implemented and evaluated a simulation-based bootcamp to be completed prior to the PGY2 year. In addition to describing the bootcamp here, we aim to evaluate the impact on trainee knowledge, self-confidence, and skill independence. The course was simulation-based, a curriculum designed specifically for end-of-the-year PGY1 neurology residents. 14 residents were invited. Our setting was the Cleveland Clinic Simulation and Advanced Skills Center, and it featured high-fidelity simulation for 3 cases with emphasis on vascular neurologic emergencies, particularly ischemic stroke, subarachnoid hemorrhage, and intracranial hemorrhage. Cases were led by the rising PGY2 resident participants and were standardized with a written sequence of conditions based on participant actions. And 5 common procedural skills, lumbar puncture, external ventricular drain management, Botox, pupillometry, and video fundoscopy, were set up at 5 separate stations with a facilitator at each, who instructed, observed, and gave feedback to trainees. Evaluation via written knowledge assessment and survey-based outcomes from both the trainees and the facilitators were completed pre- and post-bootcamp. In our third column of the poster, we highlight outcomes. Overall knowledge scores increased from average 54% correct to average 67% correct post-bootcamp, driven by significant gains in procedural knowledge in particular. In figures 3 and 4, the proportion of trainees who self-reported skill independence increased with regard to EVD management, pupillometry, and fundoscopy. Across all 5 skills, facilitators reported significant increase in the percent of trainees able to perform the skills independently. And trainee self-confidence increased from a median of 2.5 to a median of 4 on a 5-point Likert scale, representing a shift from a little confident to fairly confident post-bootcamp. In sum, we demonstrate the impact of a bootcamp on gains in knowledge, particularly procedural knowledge, as well as increased independence and self-confidence in neurology residents. We will reassess residents at 6 and 12 months post-bootcamp to determine if these gains are persistent.